Good morning from Camp Texlake. It's about 11:10 and I wanted to show you my health center where I've been providing health care for the camp this week. So here's my health center. My camp name is Howdy, so I bring a little magnet so the campers and counselors know who's providing care for them while they're here. You can see I have cabinets and then with locks because that's where I keep medications. Over here I have some educational things I printed out related to, and we also have a board in here that has some atta-girls and atta-boys and then some stuff about food allergies. I also have some things related to heat, sun exposure, some common things out in those. And then up here is where I have my common things that I'm getting at pretty much when everybody walks in the door, lots of bug bites and cuts and stuff. So I have the common things to get that: antibiotic ointment, anti-itch ointment, tape. This I use a lot for just rubbing, skin rubbing, band-aids I have, and that kind of thing. Down here where I have my little cups, and you can see I keep my cups in this little holder here for the kids to grab a cup, and then here's my water jug. Back here is where emergent care sits while I have them wait. I don't have a check-in process. I've been using like Post-it notes, and I've actually been having the children write down what's going on because kind of encourage them to take part in the care. Up here is where I have my common pain medications, or common medications, so you can see allergy and cold, pain relief, and GI are my common stuff. And then here's stuff for itching. And let me show you back here is my little office where I document. So we do have an electronic health record. We use Camp Docs, and that's challenge is keeping up with documentation. So I have to do that right fast because you forget stuff or you don't document. And then this is also the mail room for the camp, so they can see mail over there. Here's my room, and I have like a little private room, so I sleep in the health center. And my day starts about 6 a.m. I try and do some physical activity myself before the day gets started because it'll get away from me really fast. And then I have a private bathroom. And then let me show you one other spot too. Back here, there's somebody back here, so this is where I can have somebody isolated if I need to. And then laundry is there too. So, and I also have one other place. There's a bathroom in here in case I need to soak them in the tub or something, wash off. I got sprayed by an animal or something like that. That hasn't happened to me, knock on wood, the 2 summers I'm in here. This is my 3rd summer. So, I really like camp nursing. It is fun. It's nice to have an opportunity to teach the children and the counselors about what a nurse does and the role of a nurse. It's nice to, even when you're sticking a Band-Aid on, you can take the opportunity to do teaching signs and symptoms of infection. Like the other day I was putting eye drops in a child's eye, and I was teaching them how to appropriately put in eye drops. And then, like I said, I also take the opportunity to do just teaching life skills. So, like I said, I have them when they come in and they have something emergent. I make them write down on the Post-it in their words what it is that they're doing. So they're practicing their handwriting during the summer, and I joke with them and say, you didn't think you'd be working on your handwriting or math. I make them do math problems if I have to calculate something. So they really see the role of the nurse, and I guess how varied it can be and all the things I can do. Emotional support, I provide emotional support to the counselors and the campers related to life stuff, choices, those kind of things. So I do that too, and it's fun. It's, again, like I said, it's an honor, just like with having patients in the hospital, the honor that the parents give me permission to help their children grow. So I had my first camping experience here at Camp Texlake, thanks Mom, back in 1980. the late 80s, I was a camper here. I think I was like about 7 years old, and it only took that one summer, and I think I don't remember the counselors, I don't remember anything, but I do remember feeling good. So hopefully that's what the children take away from, and the counselors also as well. So I encourage you to try camp nursing, or you get your assessment skills you have to have them. You're the only one out here, and you have to really kind of rack your brain a little bit more, and you get to use equipment that you don't ever get to use in an acute care setting, or in in an inpatient setting, an outpatient setting. Wow, you got to revisit all those things that you remember learning and get kind of up to speed back again. So it's fun for me to learn about some things that I can get better at, or to I guess to experience or to learn about that I hadn't. So anyways, I hope you consider coming out one day, and maybe you can come help me out at the health center. I always have something for you to do. Thanks.